When you think about diabetes, the first thing that probably pops into your head is blood sugar, right?
Usually, yeah.
But it's so much more complex than that. This is a condition that doesn't just stay with glucose levels. It really reaches into so many parts of the body, sometimes in ways you wouldn't expect.
Absolutely. It's a systemic disease,
Yeah.
fundamentally. And understanding that broad impact, well, that's really key to getting the whole picture.
And that's exactly our mission on this deep dive. We've gathered the materials you sent us, clinical reports, review articles, all sorts of things. And we want to go beyond let's say, the usual symptoms and really unpack some of the serious, maybe less commonly discussed complications of diabetes.
Yeah, we're going to dig into the details like nerve damage nuances, explore what happens with the kidneys,
Right.
and even look at a connection to lung health that the research highlights, which might be surprising to some.
Definitely surprising. So the goal here is simple. Pull out the most important facts, the key insights from this pile of information so you can get up to speed quickly on these specific diabetes complications. Ready to jump in?
Let's do it.
Okay, so where should we kick things off? How about maybe one of the most common issues, nerve damage. Specifically, diabetic peripheral neuropathy.
Okay, yeah. Good place to start. Let's unpack that. So peripheral neuropathy, PN for short, affects the nerves outside your brain and spinal cord, your peripheral nervous system.
Got it.
And the materials. They make it pretty clear. Diabetes is the most prevalent cause, which leads us to diabetic peripheral neuropathy, or DPN.
And the symptoms described in these papers sound, well, pretty classic for DPN, don't they? That numbness or tingling?
Tingling, sometimes a deep ache, or even a burning feeling. Weakness can happen too.
Yeah, and I saw the reports mention that this pain can get really bad at night.
Yes, that nighttime worsening, the nocturnal pain, that can be incredibly disruptive for people. And a description you often see in the literature is the stocking glove pattern.
Ah, right, stocking glove. Explain that a bit.
Think about how you put on socks and gloves. It starts in the furthest points of your feet, like pulling on stockings, and then it moves up the legs.
Okay.
Eventually, it might affect the hands, too, like pulling on gloves, so it progresses upwards, distally first.
That pattern seems really, really distinctive. Why does this specific type of nerve damage matter so much, especially, for the feet?
This is where it becomes really critical. That loss of sensation, particularly the protective sensation in your feet, is a huge red flag.
How so?
Well, if you can't feel things like a small cut, a blister, or even just pressure from your shoes.
Right, you wouldn't know it's there.
Exactly. And those minor things can turn into serious ulcers. Those ulcers can then get infected. And, in the worst case scenario, this cascade can potentially lead to amputation if it's not caught and managed really early.
Wow. That really underscores why things like daily foot checks are so vital for people with diabetes.
Absolutely essential.
The reports we look through also touch on the why, the proposed causes behind DPN. What did they suggest there?
It seems like a combination of factors. There are metabolic issues linked to high blood sugar, of course.
Okay.
Damage to the tiny blood vessels that feed the nerves, that's the neurovascular component. And potentially even some autoimmune processes might be involved.
Interesting. And the risk factors mentioned.
They probably sound familiar if you know about diabetes risks generally. Things like how long someone's had diabetes, how well their glucose has been controlled over time.
Right, the usual suspect.
Yeah, exactly. Age, having high blood pressure, smoking, obesity, high cholesterol levels. It's that cluster of risks that we see pop up again and again with various complications. Really shows how interconnected it all is.
So based on the sources, how do doctors typically figure out if someone has DPN? How's it diagnosed?
Primarily, it's what we call a clinical diagnosis. It starts with the doctor really listening to the patient's story, hearing about those symptoms we mentioned, the numbness, tingling, pain.
Great. Yeah.
Exactly. And then a physical exam. They'll check sensation, often using simple tools like a tuning fork for vibration sense, or monofilaments like a little plastic thread to test light touch sensitivity. They also check reflexes.
Okay, so mostly hands-on assessment.
For typical cases, yes. More specialized tests, like nerve conduction studies, which measure how fast electrical signals travel along nerves.
Ah, I've heard of those.
Right. Or even sometimes a skin biopsy to look directly at the density of small nerve fibers. Those are usually kept for situations where the symptoms are atypical, maybe it came on really suddenly, or there's significant muscle weakness involved that doesn't quite fit the usual DPN picture.
Okay, that makes sense. So once it is diagnosed, what's the approach? What do the sources say about managing DPN, or ideally preventing it?
Well, the research points strongly toward a a multi-pronged strategy. Prevention is absolutely key, especially thinking about those foot complications.
Right.
So patient education is huge. Teaching people how to do daily foot checks, why proper footwear is important, not too tight, protective, and getting regular annual foot exams from a professional.
Makes sense.
But fundamentally, the cornerstone is glucose control.
Yeah.
The articles really hammer this home. Achieving good blood sugar control, especially early on in the course of diabetes, particularly type 1, can significantly cut down the risk of developing DPN later.
So control is key for prevention. What about management once you have it?
Good glucose control still matters for potentially slowing progression. Diet and weight loss are also mentioned as helpful factors. Then, for managing the symptoms, especially the pain, there are various medications doctors can prescribe.
No.
But interestingly, the sources also mention some exploration into alternative or complementary therapies, things like omega-3 fatty acids, vitamin D, alpha-lipoic acid, even topical capsaicin cream, though they do note the evidence for these varies quite a bit.
Okay, so DPN is the common one. The materials also brought up something much, much rarer, but sounded really important to know about. Diabetic neuropathic cachexia, DNC.
Yes, this was a really fascinating section in the sources. DNC is presented as, like you said, a rare form of diabetic neuropathy. It can be quite severe, but here's the really critical point the sources emphasize.
What's that?
It can be reversible.
Reversible. Wow. Okay, that's a huge difference compared to many other long-term complications we talk about with diabetes.
It really is. It offers a lot more hope if caught early.
Yeah.
The defining features described are pretty dramatic. First, extreme weight loss. That's where the cachexia part of the name comes from.
Right. Cachexia means wasting.
Yeah, exactly. And second, the onset of pain is usually relatively quick. Acute or subacute, meaning over days to weeks, maybe months, not years, like typical DPN often is. And the pain is intense. Severe neuropathic pain.
And where does this pain usually hit? Is it the same stocking glove pattern?
Not usually, no. That's a key difference. While it can affect the limbs, it often involves the trunk, too, the abdomen, the chest area. And crucially, unlike typical DPN, or another condition called diabetic amyotrophy, which causes muscle weakness and wasting,
Okay.
in DNC, there's usually not significant associated limb weakness, though sometimes trunk muscles can be affected. So the pain is the dominant feature along with the weight loss.
So the pain can be in the legs, arms, but also the torso, not just way down in the feet and hands.
Precisely. The sources mentioned that proximal pain in the upper parts of the limbs, or truncal dysesthesia, which is that abnormal or unpleasant sensation in the torso area, can be really important clues for doctors to even think about DNC, given how rare it is. They noted that patients often have pretty significant sleep problems and mood disorders, like depression or anxiety, which isn't surprising given the severity of the pain and the rapid physical changes.
Yeah, that sounds incredibly tough to go through. You also flag that autonomic symptoms might be part of the picture?
Yes, that's another potential layer. Some people with DNC might also experience problems with their autonomic nervous system.
Which controls?
Things like digestion, heart rate, blood pressure regulation. So symptoms could include constipation or diarrhea or orthostatic hypotension, that dizziness when you stand up suddenly because your blood pressure drops.
Okay, got it. So even though DNC is rare, why is it so critical for people and doctors to be aware of it?
The absolute key takeaway, as you pointed out right at the start, is its potential for reversal.
Right.
The research indicates that if DNC is recognized relatively early and managed appropriately, often involving tightening up glucose control significantly and managing the severe pain, the symptoms can resolve. Patients can regain the weight they lost.
That's remarkable.
It really is.
Yeah.
And it just underscores why awareness, even of these less common presentations, is so vital. Timely diagnosis can lead to timely, effective treatment and potentially avoid long-term suffering. Of course, the sources are careful to point out that before landing on a DNC diagnosis, doctors need to rule out other serious conditions that can cause rapid weight loss and pain, like certain cancers or infections.
Okay, let's switch gears a bit. Moving from nerves to another major organ system that's frequently impacted by diabetes, the kidneys. Talking about diabetic nephropathy or diabetic kidney disease.
Yes, this is a really serious one, and unfortunately, as the sources highlight, it's very common. The data suggests it affects something like 1 in 3 adults with diabetes in the U.S.
1 in 3, that's a huge number.
It really is. And, what do your kidneys do fundamentally? They're your body's filters. They clean your blood, removing waste products and extra fluid, helping maintain a healthy balance.
Pretty essential job. So how does diabetes mess with that process?
Well, over time, Having persistently high blood sugar levels starts to damage the tiny, very delicate blood vessel structures within the kidneys. These are called the glomeruli. Think of them as millions of microscopic filters.
Okay.
The damage makes them less efficient at filtering. They can start leaking things they shouldn't, like protein into the urine, and become less able to remove waste products from the blood.
And I remember the sources mentioning blood pressure, too.
Yes, absolutely. High blood pressure is a major partner in crime here. The research makes it very clear that high blood pressure significantly accelerates the damage diabetes causes to the kidneys. It's a really destructive combination.
Do people usually notice symptoms early on with kidney damage?
Unfortunately, no. That's one of the tricky things about diabetic kidney disease. Symptoms often don't become apparent until the later stages when a significant amount of kidney function has already been lost.
So what might those later symptoms look like?
When they do show up, they include things like high blood pressure that suddenly comes harder to control, even with medication. Swelling or edema, you might notice it in your feet, ankles, hands, or even puffiness around the eyes.
Okay.
Sometimes people notice their urine looks foamy, which can be a sign of protein leaking out. And as kidney function declines further, symptoms like fatigue, trouble concentrating, or confusion, nausea, and vomiting can occur.
And the risk factors for developing kidney disease, are we seeing that familiar pattern again?
Definitely seeing the pattern. Uncontrolled blood sugar and uncontrolled high blood pressure are right at the top of the list, as you'd expect.
Right.
Smoking is another big one. High cholesterol, obesity, they all contribute. And the complications, if kidney disease progresses, they're very serious.
Such as?
Well, fluid buildup can become a major issue, leading to that swelling we mentioned, or even fluid backing up into the lungs causing shortness of breath. Electrolyte imbalances can happen, like dangerously high potassium levels. There's a significantly increased risk of cardiovascular problems, heart attacks, strokes. Anemia is common because damaged kidneys don't produce enough of a hormone needed for red blood cell production. And ultimately, it can lead to end-stage kidney disease.
Which means?
Which means the kidneys have failed, and survival depends on either ongoing dialysis treatments to filter the blood artificially or receiving a kidney transplant.
So prevention here is just paramount.
Couldn't agree more. It's absolutely critical. The preventative strategies the sources emphasize are foundational but so important.
Right.
Regular health checkups, including kidney function tests, maintaining good glucose control, managing blood pressure effectively, often with medication, keeping a healthy weight, and again, a really crucial one, not smoking. Smoking significantly worsens kidney damage.
Anything else mentioned for prevention?
One other point the materials noted was being cautious with certain types of pain relievers, particularly NSAID non-steroidal anti-inflammatory drugs like ibuprofen or naproxen. Overuse, especially if someone already has some kidney impairment, can potentially cause further damage. So it's important to discuss pain relief options with your doctor.
All right, now this next section from the sources was one I found, well, particularly eye-opening. It's about a connection between diabetes and lung disease. Honestly, that's not an association I typically make.
Exactly. And the research suggests maybe we should be thinking about it more. It's possibly an underestimated link.
The findings were pretty broad, pointing to associations between diabetes and a whole range of lung conditions. Things like asthma, COPD,
Idiopathic pulmonary fibrosis, pulmonary hypertension, even lung cancer. It's quite a diverse list.
It really is. So what's going on there? Did the sources get into the why, the mechanisms behind this link?
They did, though it's clear this is an area of active investigation. The underlying molecular basis isn't fully mapped out yet, but the themes that emerge sound familiar from our earlier discussion.
Like?
Chronic inflammation and damage to blood vessels, vascular damage, seem to be playing a significant role again, potentially connecting diabetes processes to problems in the lungs.
So similar underlying issues affecting different organs.
That seems to be the thinking. The research papers mention specific biological pathways that are implicated in both diabetes progression and various lung diseases. Things like the receptor for advanced glycation end products, RAGE is the acronym.
Okay, RAGE.
And inflammatory molecules like interleukin-6 or IL-6. These are being looked at closely because they seem to be involved in both conditions, suggesting shared mechanisms.
It's not just a coincidence, then. There might be real biological links.
That's the strong suggestion from the research, yes.
Yeah.
They even give some specific examples of how this might play out.
Like?
For instance, how having diabetes might make a condition like asthma more severe, perhaps leading to more frequent or more intense asthma attacks or exacerbations,
Interesting.
or how diabetes might influence the progression of pulmonary hypertension, that's high blood pressure in the lung arteries, potentially contributing to things like accelerated right heart failure or increased fibrosis, which is scarring, in the lungs.
And there was also a really intriguing note, I thought, about the medications used for diabetes, something about them possibly affecting the lungs too.
Yes, that was quite interesting. The papers touched on some emerging evidence suggesting that certain drugs used to lower blood sugar might actually have other effects on the lungs beyond just glucose control.
Effects like.
Well, potentially influencing things like airway function or the development of fibrosis. Metformin was mentioned in this context, as were certain other drugs called PPAR gamma agonists. It hints that some diabetes treatments might have unexpected benefits, or perhaps even side effects, related to lung health that need more investigation.
Okay, so taking all of this research on the lungs together, why is this connection important? Why should we, pay more attention to the lungs when thinking about diabetes?
I think the main point the sources were driving at is that the lung might be an underestimated target organ in the overall systemic impact of diabetes.
Underestimated.
Yeah. This association suggests that maybe clinicians treating people with diabetes should have a slightly higher index of suspicion for respiratory symptoms or conditions. And definitely, it calls for more research to really understand these shared pathways. Understanding them better could potentially lead to improved management strategies or even new therapies that could benefit both diabetes and related lung issues.
So if we step back and pull everything together from this deep dive, the big picture the sources really paint is that diabetes, especially when things like blood sugar and blood pressure aren't well managed, it's definitely not just about glucose numbers.
Not at all. It's a condition that can profoundly impact multiple systems throughout the body. We've seen that with the common nerve damage of DPN, the rare but reversible DNC,
Right, the kidney damage.
the serious kidney issues, diabetic nephropathy, and even these, perhaps surprising, links to lung health.
And across all these different complications, we kept seeing those common threads pop up, didn't we? Things like chronic inflammation, damage to blood vessels.
Often driven or worsened by those high glucose levels over time.
Which really just reinforces the core message that seemed to run through all the materials we looked at. Managing diabetes effectively has to be a comprehensive strategy.
Exactly. It's not just about hitting a target blood sugar number anymore, although that's crucial. It's also about aggressively managing blood pressure, keeping cholesterol in check, maintaining a healthy weight.
And those key lifestyle factors like diet and absolutely quitting smoking if you smoke.
Yes, all of those pieces are critical for reducing the risk of these serious complications.
And given how widespread the effects of diabetes can be, touching so many different organ systems, the materials really seem to highlight the value of a team approach to healthcare.
Absolutely.
Yeah.
Bringing together different professionals, maybe primary care, endocrinologists, but also dietitians, podiatrists for foot care, specialist nurses, pharmacists, perhaps nephrologists or pulmonologists if needed.
It makes sense. You need that coordinated effort.
You really do. It almost requires that kind of integrated team to properly address the diverse ways this condition can manifest and impact someone's overall health.
So as we wrap up this deep dive, what have we really learned? We've seen how diabetes can show up in ways that maybe you wouldn't immediately expect, from very specific nerve conditions, both the common DPN and the much rarer DNC,
to seriously impacting vital organs like the kidneys, potentially leading to kidney failure, and even affecting lung health in various ways.
It really highlights the power of awareness, doesn't it? Just knowing about these potential complications, understanding some of the signs.
And recognizing the immense value of proactive management and prevention. Taking those steps for glucose control, blood pressure, lifestyle, it makes such a difference.
So here's a final thought to leave you with. Thinking about how interconnected our bodies truly are, and seeing how deeply and broadly a condition like diabetes can ripple through different systems, does this change how you might view certain health issues? Maybe symptoms that seem totally unrelated at first glance, like, say, a persistent cough, or maybe some unusual pain that doesn't fit that typical stocking glove pattern we talked about.
It really makes you pause and consider, doesn't it? It underscores just how fundamentally linked all aspects of our health truly are.